We have come a long way in the fight against cardiovascular disease, but heart attacks, strokes, and other vascular issues still represent significant cause for morbidity and mortality worldwide. In fact, nearly 40% of deaths are still tied to cardiovascular disease. Obviously, we have not been addressing all the risk factors so far, and traditionally we've been focusing on hypertension and three major types of lipid problems: the high LDL, the low HDL, and high triglycerides. However, recently, several studies have discovered that one of the overlooked risk factors is the lipoprotein A or little Lpa. Indeed, we now think that elevated little Lpa is another pathway of cardiovascular risk independent of the traditional risk. And indeed, several studies like the Proof of the Jupiter have indeed confirmed that there is a residual cardiovascular risk even after optimizing for the traditional risk factors like hypertension and hyperlipidemia. Studies using Mendelian randomization, large meta-analysis have shown that elevated little Lpa levels can double the risk of heart disease compared to those with low levels, and that this risk is indeed independent of the traditional markers that we track. Little Lpa is a complex lipoprotein made up to two main components, ApoB100 and ApoA. The ApoA itself is made from repeat genetic sequences. These repeats may vary between people, so some people may have just few, and others may have up to 40. This variation plays a big role in how much little Lpa someone has. If a patient has a genetically elevated little Lpa, the risk of having a cardiovascular event like heart attack or stroke can go up by 30 to 50%, even if the LDL cholesterol is normal. Black individuals are at particular high risk of elevated little Lpa levels. Another problem is that the elevated little Lpa is also tied to aortic valve stenosis due to chronic inflammation. So patients may develop aortic valve stenosis, and also the risk of thrombosis is elevated due to these pro-inflammatory risks that associated with little Lpa. Based on several studies, the critical level of little Lpa that triggers that increase in cardiovascular risk is about 50 milligram per deciliter or 115 nanomole per liter. In conclusion, it is time to recognize that elevated little Lpa is a major independent risk factor for cardiovascular disease. It's genetically determined, hard to modify through lifestyle alone, and the current therapy with statins or PCSK9 inhibitors is not effective.